Welcome back to another episode with myself and
CJ.
Over here on InSense, we have another very special guest today. We've got Dr Adegoke here, and we're very excited to have her on. And yeah, today we're going to be touching base on, some medical things that I'm sure a lot of people want to know about. You're also an aesthetic doctor as well, is that correct? So we're going to be touching base on that as well. Just give a little background about who you are, what you do, and just so people can understand a bit better about it.
Sure. So I'm Dr Adegoke. I'm a GP registrar, so that's like a final year GP trainee, so a few months being fully specialised as a general practitioner. And I'm also an aesthetics practitioner. So I own medical aesthetics and wellness clinic, but one in London and Cornwall.
Oh, amazing.
It's very busy.
Working
2 full-time jobs.
Another female entrepreneur.
Yeah.
The future is female.
Yes.
Well, the reason why was not even the reason. We always want to have guests that obviously are experts and people that we just want to have conversations with. But one of our recent episodes we put up was about things that sometimes us as women like cringe about speaking about, or just don't know who to go to, and we actually had quite a lot of feedback saying, oh my gosh, thanks for just speaking about it. And we said all along, we're not doctors, so please don't listen and take advice, but all we wanted to do was open up the conversation. And so we can kind of briefly speak on some of the things that were brought up last time, just to get a feel of if we were talking anything right.
If we were correct.
And then also to just get like a doctor's perspective, because there's so much panic that happens, I think, when anything happens either down there or just in general. And it's just, I don't know, like, do you get a sense of panic sometimes when things happen to you, even though you know the medical...
For sure, because I think people think that doctors don't get ill, but they do, and then because you know so much, your mind just goes to like the worst case scenario.
So it is the same for you guys as well. Oh my gosh, okay.
Oh wow, that's interesting. Would you say as well, like, do you feel because you're a doctor and you're always trying to give advice to other people, do you feel that you sometimes, because you are busy, you take less care of yourself as well? Or?
Definitely, and I think... Sorry, I cut you off.
No, that was it.
I was just going to say, I think the pandemic has actually highlighted that in some regards, because we've been, especially the first wave, we were all so busy, like not taking care of ourselves. I remember one shift, and this was when I was still rotating through acute medicine, so as part of your GP training you do 3 years and half of that has to be in hospital. And so about a year ago, like when the pandemic first started, I was on a hospital job, and I was like carrying the bleeps. I was taking all the referrals coming into the medical team, so seeing people in A&E. And I think my reg saw me and I must have looked frazzled, and she was like, have you gone for a pee today? And I was like, no. I was like, have you drunk today? No. I was like, I've done like 10 hours of like a 14-hour shift or something ridiculous. And she was like, no, you can't, like, you cannot work like this, because you can't pour from an empty cup. Like, you have to look after yourself first, otherwise you'll burn out.
It's so easy to say those things to other people. Like, we say it all the time, you can't pour from an empty cup. We hear that saying all the time, and yet it's so easy to slip in that mind frame of just go, or giving, and not actually putting that back into yourself. So I'm so glad that, like, even we have our own doctor here. How was that experience? Like, even just last year, with everything that's been going on, like, what was that like for just you guys working in hospitals? How did that feel? Like, did it feel as crazy as it was on an outside? I don't know what I'm trying to say, but being inside, did that feel 10 times worse, or?
So it was multiple things, because I guess there was this pandemic and it was new to everyone, and no one so far has lived through a pandemic. Well, and certainly we haven't even had like anything in the UK that has affected us on this scale. So it was like, as I said, like, doctors are humans as well and get on well as well. So it's having the human aspect of worrying if you'd get sick, and worrying like, what is this thing and it's going on, and it's this big scary invisible war that we're fighting. But then also going into work and having to be like, right, okay, no, this is what I need to do. We need to like save as many people as possible. And I'll hold my hands up and say, like, as a GP trainee, I in no way had it as bad as some other people, because as I said, I was on like an acute medical specialty, and then I was then moved to like a different hospital that was more of a community geriatric hospital, so that's more for like old people, so doing acute medicine for old people. And as it happened, like we were then having more of these conversations up in front about people in terms of what are your wishes, would you want to be resuscitated, would you want to go to ICU, and a lot of like having those heavy conversations, which we do have anyway, but we were just having them a lot earlier than we would have. But a lot of people were saying actually like, no I don't, or yes I do. And then so in my hospital it came to a point where I wasn't seen, like my hospital was really for people who wanted to just fight an infection if they had an infection or COVID or whatever, and if they got better then they went home, and that's great, and we could sort of rehab for them if they needed it, and rehab meaning like physiotherapy. And if they didn't or deteriorated, having another conversation saying, well actually are your wishes still the same, and also from a medical point of view, because a lot of people find it difficult to understand that that's actually whether to resuscitate someone or not is a medical decision, because it's like you're offering a treatment, so you have to decide actually is this treatment going to be appropriate, because it's not 100% and actually there's risks to that treatment, and some of those things, like if you resuscitate someone who you know it's not going to work, then actually that's quite traumatizing. And if it does work and then they come back and they've been down for a while, then they can have what we call hypoxic brain injury. So the longer you're down, and the longer your heart stops, the more likely you are to have an injury whereby that you'll come back and we don't know what kind of function of life you'll have. So anyway, all that to say is it's a medical decision. So we're having these heavy conversations. For me, like as I said, I was moved to in a hospital where by a lot of people there were there because like it was still a hospital, but it didn't have an ICU, so they didn't want resuscitation or it wasn't appropriate, and we'd had discussions with patients and families and things like that. So I was never, especially towards the first half of the first wave or the second half of the first wave, and since then I was never what I would consider to be on the front line, even though other people would argue and say I was. I felt like the front line became more in A&E and in ICU. So, and certainly the other thing is that I do my medical work in Cornwall, and then I commute sort of to London and have my clinics here. And so how things were in London was a lot worse than they ever were in Cornwall. So my experience was a lot different to say an ICU doctor, like some of my friends are in anaesthetics and they got redeployed to ICU, and the theatres, the first wave, they cancelled all the elective surgeries, and then theatres turned into ICU, like makeshift ICUs, and so they were doing that, and they were working emergency rotas, like 12-hour shifts of 3 days on, 3 days off, 3 days on, 3 days off. Wow. But then also like 3 days, 3 days off, 3 nights, 3 days off. Like they did that for 3 months. Like I never had that. I was working like a 9 to 5 job. So all that to say, my experience was a lot different. And nowhere near as bad as other people's. But even still, I was working I say at one point I was working 7 days a week, and someone was just like, "How are you working 7 days a week?" There were 7 days in the week, but I was literally working like 21 days straight or something like that.
So was your clinic born before COVID?
Yeah.
So you was always kind of working between Cornwall and London. Did COVID kind of, I don't want to say mess that up, but did it interfere a lot with the business element?
Yeah, definitely, because we had to shut. I know now technically, if you're doing medical procedures, you can be open. But I just took the stance of actually, and you said you're a makeup artist, so it may be a similar thing where I'm sure there are, for example, celebrities who have photo shoots and things. There are times when it's okay for you, or it's allowed for you to do makeup for other people. But I just took the stance of, okay, if I opened, can I hand on heart say that I'm just doing medical treatments? And even though you can always code things as a medical treatment, even though it may be cosmetic. But could I hand on heart say that, and actually is it essential? And I just thought it's not worth the foot traffic into my clinic for something that can wait.
It's just okay to accept that, like, right now I have other things that I have to focus on, and also just be a part of something that's a little bit more universal. We're all kind of, and I experienced that in the first lockdown, where it was like, when we came out of it, it was like, okay, get everything back up and running, do all this, and then I was like, whoa, this is backfiring, because we just weren't ready for it. And I think sometimes you just have to learn the hard way and just be like, okay, as a business decision, that was wrong, or maybe we should have just waited, but we didn't know. There was so much of just trying to understand what the hell this was. Still a year after, still trying to understand what's going on. But I think it's so hard when it's your business to kind of make those decisions based on like, not selfish reasons, but does my business get back, or do I make this choice right now?
Yeah, and I think I was lucky, like I said, my full-time job is training, like I'm training to be a GP, so that's my full-time job. So the clinic is just extra, but for some people that's all their work is, and so those decisions are harder. And then the other thing is, because I've worked the whole way through, I never, sort of, when it was reopening, I was not so much worried about, oh my gosh, okay, I'm anxious about COVID, or like the world has changed now, or what are things going to be like, because I've been doing it. And so like all the COVID protocols, like it was crazy. The first lockdown, like every single day we'd go into work and I'd be like, okay, we need to wear these gowns, and the next day it'd be like, oh no, we're wearing aprons, or no, you need to wear these masks. No, actually you don't need it. And it really felt like, hang on a minute, everyone in Italy is wearing these like full-on suits, and you're trying to tell me this flimsy apron is going to protect against like me getting this thing that I can see it's just like killing people one by one.
So as a doctor or practicing, has there ever been a time where you felt like you've been learning something, or someone's come to you and you actually don't know the advice? What actually happens and stuff like that? Because I know I'm due to have a conversation with you about PCOS, but I felt like a lot of the time when I was growing up and I would go to the doctors, there was just like very little information. Yeah. So I guess from, a complete normal person walking into a clinic and just wanting that bit of, I don't know, confidence. A lot of the time, sometimes with GPs, it does feel a bit vague. Yeah. What's your kind of stance on that, and like, how do you feel that, I don't know, you can offer that assistance when you feel like maybe it's something that you don't know much about, or not much about, I'm sure you have to learn everything, but do you understand?
Yeah, and I mean, one of the principles of being a good doctor is to act openly and honestly and with integrity, and based on that, it's like, as you say, medicine is so big, and in general practice there's you have to know everything, you have to be specialist of everything. So how can you can't possibly know the ins and outs of everything. Like you might know what like the common things are, but the treatment pathways or the protocols are constantly changing. So it's okay not to know everything, but the most important thing is acknowledging the gaps in your knowledge. Right. And as we say, like medicine is a career of lifelong learning. So if you see someone and you've identified that gap, going away and sort of reading up on it to understand. But then also actually being honest and saying, look, I'm not actually sure of this one thing, why don't we look at it together? Yeah. And then you can always, because that's what I do sometimes in my consultations, not so much now because a lot of them are virtual or telephone, but if someone's in face-to-face and we're not sure, we can just say, well, let's look at what the advice or what the, say if it is a gynecological thing, well, let's look at what they would want us to do before we're able to refer you. Right. And then it's like we're learning together, and then actually, even that way as well, you find people are more engaged in getting better and knowing, okay, this is what I need to do. Yeah. Because they've sort of done it together. Do you feel
like there's been common things that have come to you, let's talk maybe gynae or female. That people come to you and they're absolutely like panicking, or that is so common on your end. Like, something that people are like, oh my God, this is happening. And it's like, actually, this isn't a scary thing, this is really normal. Like, I know we spoke before about like discharge and BV and stuff, and where you might be absolutely just panicking and really feeling like, oh my God, but maybe it's a normal process, maybe it's to do with your cycle, maybe, I don't know, is there something that comes up quite frequently for you?
Yeah, so there's lots of different things, and probably the most recent thing actually that comes to mind is breast pain. And a lot of people, I always say medicine, weirdly, is like buses, where I'll suddenly get a day of, like, the flavour of the day, like one day it'll be all skin things, and another day it'll be all gynae. And so on this particular day, I must have seen, like, a few women who all had breast symptoms, or breast things with their breasts that they were coming in with, and it was, a few of them were breast pain. And they're really worried, and it's like, I've started having breast pain, I'm really worried I've got breast cancer. Whereas actually, from a medical point of view, we know that actually breast cancer is, breast pain is not really associated with breast cancer, and actually it's, if you just have breast pain on its own, like, it would be very rare for you to have a breast cancer, and there are other more common causes of breast pain.
You probably just naturally associate. I would, if I had anything wrong with my boobs, I'd be like, it's cancer.
I get, like, it's funny you say that, and funny you bring that up, because when I'm on my period, I get a lot of shooting pains in my nipples. And me being, paranoid at times, I I associate it with heart attack because it always comes in my left breast, and it's like going through my nipple into my neck. And you always hear about, like, when you get a heart attack, you get it through, I don't know, that your left side kind of paralyzes. I'm left-handed naturally, so I think naturally my pain's go on the left. So yeah, and every time I do, as CJ says, when I have gone to a GP or called for advice, it's usually like, yeah, okay, it's just a nerve. And it's so vague that you just feel like, okay, great, it's a nerve, but it keeps coming.
See, in that situation, and I think this is where general practice is not so much about just making a diagnosis and saying, okay, this is it, you're fine.
Yeah.
But actually trying to understand it from your point of view as well. And we often talk about what we call the psychosocial aspect. So understanding what you do, understanding, okay, you're left-handed.
Yeah.
Understanding, okay, is there a reason that you think, or are there any other reasons that you're concerned? It could be like a heart attack or something like that. And understanding that, because actually, to me, if you came in saying that, it's not so much, I wouldn't be so much worried that you don't know how to treat your pain, or you don't know what your pain is, because you just said that actually it's around my periods, and every time it's my period I get it. And so usually we already know there's a pattern to it, and it's probably related to that. But I would be thinking, okay, it's actually more reassurance rather than, here, take some painkillers that you'd be looking for. As in, like, okay, well, I know you're concerned about a heart attack, but actually it's happening every time you have your period.
Just
it's
to
been
have
happening for a while.
have that chat. Because sometimes, listen, I'll never understand a day of what it would be like to be in a GP and the amount of different things, so I would never take that away. But sometimes it does feel like, how many can we fit into a day that just is just eliminated? No, it's not. And like again, we will speak about this on the
live.
Yes. But gosh, mine was so poorly treated that it's frustrating, because even still I think, okay, well, if the pain is coming out, like, why aren't we addressing the fact that this did happen to me, that it could be that I get, like, and it's very, no, and I just, it is that reassurance that you want to have from a specialist. You want to have someone say, look, okay, all right, if this is what's happening, can we try this? Can we, it's just that broader, just rather than, it's this, take some painkillers.
Like, bye, see you later. And on that note as well, taking some painkillers, I'm, as you know from the tea that I made you, I'm really into thank you. I'm really into like healing yourself and herbal healing and natural, holistic approach to life and your body. And I'm a true believer, unless you really, really need to be cut, not to go through like surgery and take antibiotics. There's been so many times that I've gone to the doctors and I've had problems down below, whether it's an infection or, you catch BV or whatever that you get. And, immediately, anytime, here's some antibiotics, take it. And I have taken them in the past, previously, and I found that it's never worked. For me, personally, it's done the opposite. It's dried my, I've gone dehydrated, it's like, made me feel dizzy, giving me migraines. And when I've done my own, like, kind of remedies and whatnot, I've healed myself from it. So from a medical point of view, what is your take on, like, being prescribed with antibiotics and painkillers and medication in general?
So I think it depends on what's going on. So there's some things, for example, like a UTI, for example, that's a bacterial infection of your urinary tract. And there are things like cranberry juice that you may have read that helps soothe the symptoms and things like that. But because it's a bug and it's a bacteria, it won't go away necessarily on its own, and actually untreated it can lead to other things. So that's when that would be a good indication of, okay, you need to take, we'd advise you to take antibiotics. It's a 3-day course. Get rid of the symptoms, and then things will settle down.
Are there implications then of not sometimes taking these things?
For example, so the infection could spread, for example, or it could track up to your kidneys, or actually it could not be a UTI, it could be like a bladder infection or kidney infection, and that can get worse, and you can get sepsis. Not to fearmonger, but with everything, there's risks of treatment, there's risks of things being left untreated, and there's also risks of the treatment itself. Like you said, some things have made you feel sick and given you migraines and things. And so your GP should be having that conversation anytime you prescribe a medication, saying these are the benefits that you'd get if you took it, and these are the risks. Then you weigh up, and then it's up to you whether or not you want to.
I feel like they don't. I feel like the GP did not. I mean, I can't speak on on behalf of every single GP, but the ones I've been to, always, I think that's such a good thing for someone to explain to me what the benefits and what the pros and the cons are of the medicine that I'm taking, rather than like, here's an antibiotic, take that for 7 days. If it's still not gone, then you come back to me. It's like, okay, and then you kind of have to go and Google it yourself. And we all know what happens when we Google, right? It's, you just, the first thing comes, you might die. So you just, you might just. So I try to avoid Google, but you know, you want to do your research. So I think it's so important, like, and it's so refreshing to speak to a GP.
It really is.
Like that.
I've never actually, when I think about it, I've never actually spoken to someone who like practices. So just to even hear your approach and just wanting to be more like broad with what you give to your.
But that's, I would say that is the that is where the bar should be. Like that's what you should be getting. So like the next time you go to your GPs and they prescribe you something, then just to know for yourself, because you're supposed to be making a decision, and you can only make an informed decision if you're given all the information to help you come to that decision. And it's okay if you decide, actually, I know it's a UTI and I know things can get worse, but actually
it's my
the last time, because it's your body and it's your, we call it patient autonomy. So you have to make an autonomous decision, and the only way you can make that is if you have all the information, and you shouldn't have to go away and Google to get that information.
Absolutely. What was like the reason behind wanting to do what you do now? And obviously we'll go into, I know you have a wellness clinic and you do aesthetics too. Was there a reason to start this and then like divert to this direction, or was there always an idea of doing a bit of everything? Like, what was the plan?
So I don't think I really had a plan. I kind of just like floated along. I did a lot of A&E, and actually I decided I wanted to do general practice just because you get that rapport with your patients, so you get to see, you get to know people. Once you've worked for a while, like people come back to see you, and I quite like how they want to see you.
Never had it. I've been in my GP for at least 12 years, and I've never had one person I go back to because I find that and this is I'd love to have that. I'd love to every time.
See me.
No, I'm like,
I will laugh. I really will. I really will. But it's true. Like, it will give you the option. Do you want to have? You know, I did like an online consultation the other day, and it said, "Do you want?" And I was like, I don't even know the names of my doctors. How bad is that? I've over 12 years I've gone to my doctors, and I wouldn't even be able to tell you his name. You know, just for. And I go to the hospital regularly to the doctors regularly to have checkups and stuff with what I've had going on. So just to not have that reassurance, this conversation has instantly made me think, maybe I just had that unlucky, you know.
I think as well, as Mariam said, you know, for me now, if I do, you know, when I do go to the GP, it's me questioning them.
And we can have that responsibility as
well. Having that responsibility ourselves, but of course, having that rapport with you and your doctor gives you more confidence as well in the procedures that you want to take.
It's so crazy because you have that with your nail, right? You have that with your
GP. Your eyebrows.
You have a nice relationship. So you should want the same for your doctor. So have you felt a difference with the aesthetics that you do? Like, have you felt a bigger rapport with that? Oh, sorry, I still did cut you into your journey. But you
navigate us through.
I can't remember what I was saying. So I was saying, like, I wanted it to have a rapport. And just from your point, and it's a shame because general practice used to be so much about named GP and having that. And because things are busier and time is like 10-minute consultations, it's moved away from that. And obviously with waiting times and things, if you want to get seen quicker, sometimes it's easier just to go with any doctor rather than your particular doctor. But you could, like, if you did find someone and you had a consultation and you thought, oh, okay, I quite like them, you can request to see them. It just might mean waiting like that extra week or 2 weeks longer, for example. But yeah, it's a shame that general practice has moved from that to becoming sort of like a busy, pressured, but then that's just the problem with it, is part of the problems with NHS.
It's so frustrating because it's such a beautiful and like amazing thing that we get to have here. Right. And, like, I would never,
for free,
you know, like I'm so appreciative of
it.
The amount of surgeries, especially at my age already, I've had. I think, Jesus Christ, like I'd be up to my eyeballs in debt if I was to live in America or something. I literally would. Like, I've had at least 4 or 5 ops. Like,
it's definitely a luxury. Mariam, what was the inspiration for you to start wellness and aesthetics?
How did that? I, as with everyone, I've probably had my own journey with fitness and like trying to like navigate that and things like that. And then the reason, as I was saying, so I did lots of A&E and I actually quite liked like building a rapport with people and having that sort of continuity of care and seeing people come back and be like, oh yeah, how have things been? And also it's quite great if you're a nosy person and you like gossip because you're just like, oh, okay, so this patient is married to this person, but like had an affair with this person, and you get to know, like honestly, like forget the tabloids, become a GP because
I can imagine
the amount that people tell you and the amount you get to know it, and it makes it really interesting.
You probably hear so many different stories, just in general.
I've had so many times where I've been like, hang on a minute, I've never met you, but I definitely heard this story before, but it just, I'm remembering it differently. And then you realise, like, you've heard it from someone else, but from their point of view. And obviously you can't say anything, but it's so interesting. So I kind of, like, sort of liked it for that, and I liked being able to help people. And as I said, I did a lot of A&E, and then it's great being able to run traumas and these testings, but after a while, like, it's very much like,
heavy
protocol, like it's ABCDE, like you follow the steps and you get good at it, but it's very, although you never know what's coming in, it's you follow a set thing pretty much.
There's a structure.
Whereas general practice, like you still have that same pattern recognition in working out, okay, is this BV, is this UTI kind of thing, but then you get the added like life stuff with it, which is like the kind of stuff that makes it interesting.
Just to hear little things when, like, I remember going into one of my doctors before and like just talking about I can't remember what was going on, but it was stemmed back to my eating habits, and then we started talking about my routine, which is obviously in the theatre, and then she started telling me about her child that was in the theatre, and then we were just having a good old chat, and I was like, oh okay, this wasn't what I was expecting today, like, can you help me with like going to the toilet? I don't know, like, but yeah, you know, it's definitely, there's that element of trust, and I would say, even though yes, I've not had the best experiences or whatever, there is that element of trust when you do walk into that room and you think, okay, I'm trusted with what I'm going to say, I know that I'm not going to feel like judged or you've probably heard 1,000,001 stories, so I'm sure this is just one of, you know.
Absolutely. What is your, just stirring a slight different direction now, but going back to wellness and aesthetics.
Sorry.
No, it's alright. No, it's because obviously, as I told you earlier, you know, I'm a trained makeup artist, and I've got, you know, so many people I've seen have work done, and, you know, from Botox to fillers and other procedures that you do as well. And what is your what's the word? I was going to say logo, not logo. What's your oh my god, what's the word? I've gone completely back. What's your outtake on sort of why have I gone blank?
Like,
you know, when you have not opinion, you know, when you have a company.
My motto,
not motto. What is the word? That's gonna bug me now. I've gone completely blank. Your what is your you know, when you have a brand and you have a slogan, what's your can someone help me?
I don't know, baby, I'm so sorry. What is your, I don't know, sorry.
I'm having a black book. Anyway, what's your advice on anyone that wanted to get work done, and it's their first time, they're not too sure about it, they don't want to have, I don't agree with going crazy with aesthetics. I don't disagree with it, because I feel like every little helps, and we all need help at some point of our lives, especially when you get older, right, ladies? What's your advice on that?
So in terms of my advice, okay, so I'd ask people to sort of look in the mirror and ask themselves, like, what they want and what are their reasons behind having it. Is it because they've seen it somewhere and actually and they get a lot of people saying, oh, I just want to know how it feels, and it's like, I mean, it's a medical, although you see that in the UK that beauticians are able to buy filler and give people fillers, which, I mean, I think it should be a medical procedure, because it's injections, it's needles, there's risk, so I don't agree with someone trying it just
to... It's the wellness side of what you're doing, like, how comes it's wellness and aesthetics? Like,
Okay, so going back, I'll answer the wellness thing and then that will make more sense. So the wellness, I guess, came from, as I said, having my own journey in terms of like fitness and health journey and sort of navigating that on my own. And then also being, and I think it's largely part of being a child of ethnic parents. So my background, well, I'm Nigerian, and I don't know if you, like, what your heritage is.
Iranian.
Sri Lankan.
Okay, so you'll both get this. The diet, I know the Nigerian diet is very like oily, carb heavy, and fried everything. And then Sri Lankans, because I basically like all our family friends are Sri Lankan, so I know Sri Lankans are similar. And I think Persian food is a bit similar as well.
A lot of rice.
It's all heavy. It's all heavy.
Yeah.
And my mum and my dad are both, like, my dad's a GP as well.
And they're feeders.
The feeders. They should know, they're feeders who should know better. And it's like, you are healthcare professionals, like, this is not okay. Like, how is your plate, like, 3/4 rice and, like,
literally
the rest meat?
Why
and,
is
like,
it
no
rice
veg?
with our cultures? Like, what's the big deal, y'all? Like,
I think it's probably maybe because it's like, I don't know if it's cheaper or easier or the climate or something. There's an obsession, but I don't know why.
You get rice with bread and potatoes and all the way.
And then like
and meat.
Like on Sunday in my mum's house, we had like two, like fried chicken, and then we had like roasted chicken, and then we had like two different types of fish. Why? You can eat like, and she's like, help yourself.
I couldn't believe how much I ate on Sunday. Like, and I'm not religious, so it wasn't for like Easter Sunday. But my mum does, and I was just like, Jesus Christ.
It's not just one dish as well. I think in our culture
we had like curry dishes, we had the roast, we had like, I was like, Mum, please, hello, I like PT every week, can you give me a break? Like,
and it's from that, and it's like, so if you've been in that and had that conversation with your parents and tried to educate them, like, no, it's not acceptable for us to just be eating carbs and meat, like, it has to be more varied, like, we need more vitamins,
we need to do more greens.
Yeah, we need more greens. And so I guess, like, my whole life I've probably been doing wellness because I've been trying to educate my parents.
Love that.
And it's just, even just the small changes, I've said, okay, in jollof rice, you can make it with like plum tomatoes or like canned tomatoes, and I kind of said to my mum, why can't you just make it with fresh tomatoes? That's less sugar.
Absolutely.
And like, instead of using palm oil, like, which we use a lot in Nigeria, I said, well, why can't you use olive oil and just a little bit, and don't go so crazy on the salt, and maybe like just a handful of rice. I'm like, I can't possibly have just a handful of rice. I can do everything else, but that's too far. It's like, okay, well, let's stop being so. But it's that kind of thing, and just over the years of like just that education, and now my mum makes jollof rice like with fresh tomatoes, and she's like, look, I don't use sunflower oil, I don't use palm oil anymore. I use this. But like, she can make the changes, and she's done really well, and just from that, like,
I guess when you see it happening from a product of you just caring and being mindful about what you do, and whether it's the food you eat, the exercise, and then seeing it, especially with the older generation that are quite like, they don't want to budge. When you see that happening, you're like, why can't I take this to my work? Why can't I take this to help more people?
And I feel like if you can, because and they're the same people. Like, my mum's hypertension, like, she's got high blood pressure and she's got diabetes, and I'm sure her GP would have turned around and been like, okay, you need to lose weight and eat healthily. She would have come in and been like, what? Like, I don't even know where to begin. And so if you can, and I always say, if you can teach like a Nigerian, and it goes for any ethnicity really, like, if you can educate them about making the small changes that will go a long way, then you can help anyone change their diet and their lifestyle. And like, she has done it, and she's sort of lost weight and her blood pressure is now controlled. And it's just, it goes to say, like, the kind of medicine, and first of all, in general practice, I just don't think we have the time to sit down and educate people like that, which is a shame, because I think lifestyle medicine is a big part, and it's going to play an important part in managing a lot of diseases like heart disease, high blood pressure, strokes.
I've learned that a lot with Sasha, if I'm honest. Like, Sasha's always been into this kind of thing, and I was the complete opposite. I was so unhealthy. I mean, I'm sure when I have a conversation with you or even other people, I'm sure maybe that has aided the things happening with my ovaries. So like, I don't know. I don't know how it all works, if your diet is a big part in that or not. But like, just those small, like, I've never ate greens. Sasha introduced me to greens. Like, she made me try couscous today. Like, quinoa. Okay, quinoa. Sorry. No. She made me try quinoa today, and I was okay with it. So it's just those small changes, and then I will take that home, and then, okay, let's try and make that now. And now I will take that on to the next person that I see. I'm eating fruit every morning now. I hadn't ate fruit for nearly a year. I hadn't had veg for about 5 years. So, to think that just those small, little things have now, affected my life, majorly. I'm from your point of view, from a medical point of view, how much further you can spread that to all the people and the clients you must have.
And that's exactly why I did it, because a lot of people, if eating spinach leaves to lose weight and as whatever they think they're being advised by their GP, if they would be able to stick to that, then they would have. But the fact that they're not, and actually you like eating what you like eating, and you can't tell Sri Lankan, Persian, Nigerian parents, okay, you're not allowed to eat this anymore, you need to start eating this. They're just not going to stick to it. So it has to be in
something that
their
works.
language, or something that they're going to be able to stick to. And so that's why I always say it's better to make the small changes rather than being okay, stop cooking all of this, we're going to bring this in.
I definitely agree with that. Again, as I said earlier, and CJ knows too, most of my friends know I'm really into eating well, and that's not because I'm trying to be healthy, but it's been part of my life and lifestyle since a very young age. I used to eat raw mushrooms when I was 3. It's it was very odd for a child at that age to raw mushrooms. Who does that? Or caviar. I was really into caviar.
You're just bougie.
That was my mum said, thank God I could afford to buy it for you. But my point is I definitely see the difference in preventing things and preventing diseases and problems. The older I get, the fitter I'm actually getting. The older I'm getting, the fitter I'm getting because of that. And teaching, I agree with you. I think you have to educate yourself and help to educate others. I've always been into learning different, for example, I'm really into Ayurvedic medicine. But also really like the alkaline diet. So, learning about both different things that I'm fascinated about, but then making it Sasha's way, what works for me with the Persian.
Otherwise, you say, you're just going to fall on, start something and then fall off. I'm sure if you'd had said the first time I come here, you fed me something that was all veg, I'd be Sasha, no.
I kind of little by little.
But that is the small thing, and I know you know Sammy as well. That's what she said to me. She was don't. Please God, don't say to yourself one day, you have to have everything under the sun that's healthy, because you're just going to go, I'll just go back to eating KFC. Because 100,000,000%, that's what kept me in those kind of bad things for so many years, because the change felt so drastic. Whereas now I'm I tried that veg, alright, I'll try a handful of that, and then sooner or later my plate, I'm who are you? I posted on Instagram the other day, who is this girl? My mum replied, give me back my daughter. She was I don't recognise you, but that's great if you can change yourself and change,
And it's just even changing that sort of relationship you have with food, about eating to nourish yourself and take care of your body rather than eating just for eating's sake, and actually being conscious about what you're eating.
Absolutely.
And as I'm sure you'll find that it's a journey. And you get to discover new
especially someone like myself who's Sasha, what did you try and make me eat the other day? And I
avocado.
No, I was the same. In uni, my friend force fed me avocado.
I know. I was
now I'm grateful to her. I was what was wrong with you? Avocado is my go-to.
I still don't eat it. I tried it.
She'll get there, right?
I genuinely had a
She was having a panic attack right there, and she was shaking. I'm and I'm not. I'm a tough love kind of girl, right? I don't do the okay, darling. I was listen,
Yalla, come on.
I was I haven't got time for this. You said you was gonna try it. Sit your ass down. So she was
no, but the point is, just small changes are gonna help.
Maybe not as harsh as I do.
No, but this is good. I needed that, but not again. I didn't tell you what I can't stand is when someone preaches a lifestyle to you, and everything with you has always been about inspiring me to change and inspiring different lifestyle habits, rather than going, oh my God, well, if you don't do this, you're just going to get a massive defense mechanism over it.
Absolutely. I would never impose something on someone if I don't do it myself.
I'll be honest, it's the same with veganism. I already struggle with I already struggle with eating what I do. So when someone tells me, oh, but you should, and I'm you don't understand.
No.
It took me 20 years to even move away from a chicken nugget. Please help me. I need what? So for me, it's I'm conscious, and I'm praying that I'll make small decisions to make a better lifestyle and the choices I make with food, and but just remember that everyone has their own individual journey with food, with everything, with
and also it's
injuries,
important,
whatever it is, everyone's body's different and unique, and they've all had such unique experiences with growing up. Like you say, your parents. Like imagine us going home and saying, "I don't eat meat anymore." Like
my brother did that.
Well, I did that.
I know. But again, it's those changes. But you adapt to that. But it's in your time. It's rather than feeling like, "Oh my god, I have to do this because I'm getting pressured to." It's like, no, I want to do this. And the more and more, whether it's having dinners with you and just exploring, my mind starts going, "Oh, okay, what could I possibly be if I tried this or I eliminated that from it?" And I'm sure in its own time it will be what it needs to be. Sorry, going back to aesthetics quickly.
Yeah.
What?
So that's how I got into wellness.
Okay.
Yeah. So I guess I've always been into wellness, but it became more important to me as I followed my own journey and started seeing the importance of it from just nourishing your body and taking care of yourself point of view. And I always found that I did feel, as you say, I felt a lot better when I was nourishing and sort of looking after my body. And even with fitness, like working out, not just because you feel like you have to, because you're trying to get to a certain figure on the scale, but just because of the way it makes you feel and like getting that movement in makes such a difference. So that was so it's a bit of like my having sort of been around that my whole life, and then also having my own journey, and then seeing that actually my parents do it. And now my dad, he's just got like crazy motivation, and he's like started really like exercising and just thinking about how much he's eaten, and he's like his main thing is like, it's just about portion control as well. I don't even need to do like these crazy big things. And again, he's a GP, so it just goes to show. But now he's lost like 10 kilograms, and he's like, I just need to lose like 10 more. Like my whole life I've known him as like being like overweight, like, and now he's like almost like fitter from he's getting fitter from a cardiovascular point of view.
And
for him, his journey
there is this idea that when I'm older I can't do this, and
there's no such thing.
Exactly. So that's
never
amazing.
too late.
Have you had people come in with this like, I'm getting this done, and maybe for aesthetics reasons, and then had a conversation with you and then maybe changed their mind? Have you had anything that's like?
I've had. And as you say, it's part of it, and you kind of said sort of I do GP one side and aesthetics, and how do the two relate? But actually I think they're quite similar, because when people come in, as you sort of, we gave the example with you having your pain, and actually it's about really understanding the real reason why someone's coming in, and actually 9 times out of 10 it might just be like actually they want this done, and most times it's that someone's got like a line here and a wrinkle and they've seen it, and a lot of my clients tend to be older sort of ladies in their sort of 50s, 60s. And they say actually in graduation and birthday photos all I can see is this one line that maybe no one else can see. But I always say, and my mantra, is that the word you're looking for?
Oh my
mantra.
God!
There it is.
Oh my God, that's what I was like, what is your mantra behind it? For God's sake. It was literally bugging me, like I could see it, but I couldn't, it wouldn't come out.
It's on the tip of his tongue. So my mantra is that if you have something on your face that bothers you that much and it's getting you that down, and I can do like a couple of, like one injection every few months that will make that go away, and it'll make you a lot happier and less self-conscious, then knock yourself out, like definitely like go and have that done. But what I won't do is, like, for example, you say some like, as I said before, some people are just like, I just always wanted to try lip fillers for like to see what they're like. Actually, no, that's a medical procedure. Like, it's not just, you don't just try like, let me just have a general anaesthetic just to see what happens. People don't do that.
I really enjoyed the experience. No, I'm joking, but like, yes,
I've had
easy
clients my clients have been 21 to like from 20 to 25, and full works. I'm talking about Botox, fillers, and to a point where the face becomes unrecognisable and
overfilled.
And I always think, what is the because obviously I feel like some people, not everyone, but some comes obviously, or most people, you're something that's you're insecure about your features that you want to enhance or change, and then why would you at that age, would you perceive someone, so would you go ahead with a procedure on someone that was like 21, that came to you and said, I want Botox, what would you...
So again, and it goes back to sort of understanding the reasons behind it, so, for example, if someone has like, it's different in a 50-year-old who has a visible line and says, look, this line, it really annoys me, like, it's all I can see. Can you make it go away? That's one thing. But in someone else who I think might have like body dysmorphia, then actually treating it isn't treating the underlying problem. So it's really important to try and establish the underlying problem.
Are you allowed to turn people?
I turn people. And you'll find a good practitioner will turn people away because, like, sure, I can make money if I do it, but is doing it the ethical thing to do? Is doing it the right thing to do? Not always.
Yeah. Do you feel like that's a problem in the industry? Do you feel like people are just doing it for?
I think people, if I say no, I'll turn someone away. There's always someone else
that's going to do it.
And will do it for them. And it's because the industry is so poorly regulated, so it's up to the individual clinician. And that's also why it's important to do your homework in terms of like who's going to inject your face.
Yeah, because I've gone to, I've been tempted to like obviously get work done, and not because for the reason, let me just try it out. But I've always had lines on my forehead since I was like 20. It's I know it's nothing. It wasn't a wrinkle necessarily because I was so young, and it's always been there. So, but doing the research, and I've actually gone to someone and they've said, no, I'm not going to do it on you.
And I love
that was a good part. That I'm not going to put that procedure on you because you actually don't need it.
And I find that the clients I have said actually, no, I'm not going to do that. They come back to me and have something else done, and there's always more than one option. So as you say, for example, use the example of the line. Botox might be the option that most people would offer you, or it might be the obvious one that you go in saying, oh, I've read about Botox, I want that. But there's also other things like peels and microneedling. There's other options. So a good clinician would give you an array of options, just like in general practice where your GP might say, well, this is an option, or this is an option, but antibiotics, these are the risks, the benefits. The same way, a good clinician should be doing a consult first, not injecting you the same day, and giving you the options and saying, these are the different options.
Having a consultation, I think, is really, really important before you get any procedure
I would definitely
done.
say, like, you should be, if anywhere will offer you treatment, especially for fillers, on the same day as having a consultation, like, run far away.
You hear that, guys? Did you hear that? So anyone wanting any work done, if they're going to put a needle on you on the same day, then you're at the wrong
You're the wrong hand.
Miriam, you should go to Miriam.
Come to me, guys.
Honestly.
But you should have time to like think about it and weigh up and make that decision.
I love it when I've had friends that are like, I'm not against work. I am a big believer in like owning what you have, but like you say, if it's actually damaging the way you view yourself, and it's something that's like just you're uncomfortable with, it's like it's okay, but for those reasons, even if you do want to enhance something for the sake of feeling, whatever it is, just think it through. It is a procedure at the end of the day. Like, I didn't have to think through having the surgeries I had because they were clinical. There were things that needed to be done.
But
because
it's also still a decision, like, if you don't have it, these are the risks. And so it's a decision you were able to come to a lot quicker. But
like, I remember even having my tonsils out. It was like, right, do I keep having tonsillitis every 6 weeks, or do I get these bad boys out? And it was like, I would prefer to, and that was a decision I wanted to make, and I'm so bloody glad I did. But I'm sure, no different, if I wanted my breasts enlarged or reduced, whatever, I would want to have that decision that I've come to, that I've taken my time to recognise why is it coming up, what are the things that's triggering it, is it just because, is it an insecurity, or is it something that I'm just I want, and I think that's okay, so long as you're having that conversation with
definitely.
yourself.
And also think about, like, are you doing it because, like you said, you genuinely want to do it, it's something that's been really, really, really bringing you down, or is it to do with the pressures of social media? Because I think, like, right now with so many influencers, and not all influencers, but everyone, looking so perfect, and there's loads of people that use filters or whatever that make it look like, and all the filters on Snapchat, and you kind of do it, and you're like, oh, okay.
It's actually crazy. I can barely find any filters now that actually show my real face, unless you're just taking a normal picture, which is like, I couldn't remember the last time like most people take. You go on Instagram and you see just unfiltered things. It's crazy, but I've worked with people that are now saying, I wish I didn't have this, or actually after, because you age, not in like a thing, but you age and you go, I did that for the wrong reasons back then, I'm going to do this, or, like I remember someone like my mum, she might have needed breast reduction just for her back and stuff. And I understand certain things that if it's going to enhance your lifestyle and just the choices that you feel, you know, whatever that is. If you're a dancer, if you're something and you need something done, like I understand lifestyle choices, but again, just taking time, like taking time to think these things through, because you are changing something about you that in a year you might go, oh, actually,
that's another thing with the you said about the 21-year-old, would I turn them away? And I kind of said it depends. Again, a lot of people come in and saying, oh, Kylie Jenner, I want my jawline and lips like her. Again, run far away. I like when people say that, because fashion changes all the time and it's a trend now. And big lips are I love that big lips are in, because I'm like, finally, like, big lip girl.
It's like same with being a curvy girl. I'm like, oh, so now
this is my time.
But anyway, listen, growing up in my industry, I was not, like, having my body shape was not the one. Like, you had to be stick thin, 6 foot, you know, not 6 foot, but it was so different. And now it's like, people are literally paying money to have a figure. And I just think, this is crazy. I grew up with so many insecurities for the other reason, and now it's a trend. So
and it's not going to last forever.
No, and there'll be so many different, it'll go back to thigh gaps, and it'll go back, you know, whatever it is, it does its rounds. I think you just have to be comfortable knowing that whatever trend is happening, big bums, big lips, whatever it is, skinny waist, I'm cool with my body. And if you're not, question it, have the advice, go and have the conversations to make sure you're making it for the right reasons, and the reasons that you're going to be comfortable with, not just for now, the next year, but for your life. So even if, you know, the works have kind of faded over those years, you're still comfortable with the decisions you made of you know, whatever it is that you've done. But I don't know, if there's one thing that you would say to anyone that's wanting to get work, and just finding that initial confidence in, you know, their self as well, is there anything that you would put out there to people, either about coming to see someone like yourself or having the conversations initially? Like, what would you suggest?
So again, it's just about trying to understand the reasons why you want something done. Is it because you've seen your friends and people on social media get it done and you want to look the same way, and there's that kind of look, as you say, contoured cheeks, like chiseled jaw, hourglass figure, like is that because that's the current perception of beauty, or is that because you've always wanted all those things? So I'd always say start by challenging, actually, okay, I want this, why do I want this? And actually sit down and discuss it with a clinician. And as I said, a good practitioner would sit down and I'd be able to identify it and go through it with you and say, well, actually, as we've said, like, trends change all the time. At the moment, yes, angled jaws are in, but a lot of people, and the reason that people are getting their jaw filled, because actually to get that beautiful contour in your jaw, you're actually, fillers add volume, so you're adding volume here, you're adding volume to the jaw. So actually in women, you're masculinizing the face and widening the jaw from the front on. So actually, then I'd explain that, and so from the side, you might have a beautiful angle that actually your jawline is fine anyway. But from the front on, it makes you look wider.
It's like doing a bad contouring job.
Exactly.
Wow. And again, it's hearing it, they'd be like, oh, I didn't know that. I'm sure so many people don't, so having the conversation is so necessary.
A lot of my clients think I'm like, not that I'm scaring them out of getting treatments, but I really get them to think.
It's so good. I feel like that is the wellness side. And I feel like that's, as soon as I saw that that's what you do, I was like, it's so nice that something that can seem so, not fake, but, you know, artificial, you know, aesthetically pleasing, to have that wellness approach and to have that feeling of like
mindfulness
behind it. It's so nice. So I don't know if there's somewhere where everyone can visit you, where people can find your page or come to see you, where would you let them know?
So I'm on Instagram at Adegoke, Adegoke Clinic, or my website's www.adegokeclinic.com. And like I said, even if you decide to go anywhere else, just make sure you book a consultation, take that time. A good detailed consultation will be, depending on what you're going for, but it should be half an hour to an hour to really sit down and have things laid out for you clearly, and then go away and take time to make your decision.
Amazing.
And it's like you said with the breast surgery thing, like, surgeons, clinicians, we're not going anywhere, so don't feel like you have to hurry and make the decision in that one day. Like, you do have time.
Absolutely.
And ask for other options, and also ask to know the risks and the benefits of everything as well.
Same with the GP. Like, you know, if there's anyone out there, as I say, I wish I felt that confidence now before
right.
to just say, oh, well, what would this help or not help, or so I feel like this has helped us just have a chat with someone that we just feel like we trust now. So we'll be coming to you all on Instagram.
I wish you was my GP, right? Now Mariam's gonna be my GP from now on.
But thank you so much for coming to join us. I know you're based in between London and Cornwall, so listen, we've even got you if you're in Cornwall. But yeah, thank you so much. It's been lovely to have a conversation and feel that trust again.
Yeah.
You're welcome. You're welcome. Thanks for having me, guys.
Thank you.
Thank you.
Bye.